Okay, another week one very important little tip here is when we look at these things here, this goes to general functions of the program and we'll keep it into the patient's chart. So one really important one is the prescription. So the RX is prescription, and you can click on that and we have the already pre-made prescriptions. So you click it and then you say okay, but when you say okay, now you print it. So when you print it, it's going to ask you to print, and now you print that out. What happens here is that it actually adds the script right here, down here, and we always like to use this for prescriptions if we can. So it logs in that we prescribed them some pain meds or something. Now with pain medications, we cannot call those into a patient. We have to write out a hand script. We cannot print something, but it's always good to log that in. So the most important one that we use a lot are the antibiotics. So that would be right in here. Amoxicillin, if you're not penicillin allergic, is amoxicillin. The second line is clindamycin. So you want to use clindamycin if somebody's allergic to penicillin. After that, then let the doctor decide on what type of antibiotics to do. And the doctor is going to be signing the script anyway. But when I do a lot of implants and surgeries, usually the assistant prints out the script and asks the patient if they have some sort of allergies to antibiotics. So they have it ready for me. I just double check. So I prefer to work faster with a flow like that, and that the assistant understands what they're actually doing. So that's one thing up here. Now, we don't use the eScript, and the next one will be the lab case. So we have our labs that we work with here. You would just click on the lab. So let's say it's an in-house case, and now you can add the instructions in the instruction thing. So we put the color, so A3, shade, and then we say number 19, crown, and the type of crown it is. So porcelain, use the metal crown, or we can say a different crown would be like an all zirconia. I'm not going to write that in, but you get the idea. And now it'll log it into the patient's progress notes, which is very handy to have to do, so you don't have to write that down. And new slip is where you go to print. There's no print page here, which is kind of annoying, but you print by saying new slip. It'll have this in, and then you can say print here, and then it'll go to the printer here and you can print that. So that's extremely helpful.